Good afternoon, everyone. Sorry for the late start. We've had some technical issues getting the ball rolling today. We'll see if we can get some participants logged on. Again, our apologies for the late start. I know as well, we will be missing the participation of some of our normal presenters. We have some network issues occurring that seem to be impacting Zoom today, and we weren't able to get everybody on the panelist side collected in time. So really apologize. Do see some participants joining, so that's good. There is some ability for everyone to get in. So we'll proceed regardless. We have some important updates today, but as I said, we will be missing a few of our presenters due to some technical issues and network issues that are preventing Zoom access today. So I'll begin our meeting. We won't have our standing operations update from Sharon Pearson. Sharon's one of the folks that couldn't join us this morning. But I would start with our land acknowledgement. As is our custom, we're privileged to provide care on lands that Indigenous peoples have called home for thousands of years and recognize and respect the presence and stewardship of all Indigenous peoples as keepers of this land. Okay, so next slide. So yeah, this is our normal update, but we have Dr. Mertz is with us, Dr. Lum is with us. Unfortunately, we couldn't have Sharon, who is our opening presenter. Let's keep going. Maybe we could just pause and I could acknowledge the West Lincoln Memorial Hospital sod turning event, which I know we had a photo of there, which occurred last week. It's a wonderful thing for a hospital to get built in the mandate of any government. And we're very pleased that Hamilton Health Sciences was able to mark this particular milestone as we head into an election and a new government to come, but very happy to have received the investment in our West Lincoln Memorial Hospital site. There's a picture there of some folks participating in that sod turning. Okay, so next slide, please. Skip the operational update and go straight to Dr. Dominic Mertz, our Medical Director of Infection Prevention and Control, for an update on the pandemic. Dominic, over to you.
Yeah, thanks, Aaron. I keep it very brief today because there's not an awful lot to report. Hospital admissions here, overlaying the science table predictions, and you can see we continue to do much better than expected, even in the best case scenario. Things have flattened out, so we are plateauing now for pretty much 2 weeks now. It's not declining yet, but it's quite stable at around 1,700 to 1,750 patients in hospital. Next slide. ICU admission, similar picture, flat, plateau at this point, hasn't increased significantly from where we were back at the end of March. Again, not declining yet, but it looks like we probably have peaked. Next slide. The Hamilton picture, as I would have predicted a couple of weeks ago, we were lacking behind. We now see the plateau as well. The models would suggest that we might increase a little bit more this week. Hasn't happened yet, but if so, it wouldn't be an awful lot. And after that, we expect that number of newly admitted patients with COVID, I have to say, when looking at this figure, will start to decline over the weeks to come, going into June and July. Next slide. ICU admission remaining relatively stable, as you can see here. The expectation for the peak here would be next week, but you can see that the peak isn't much higher than where we are currently at, so we might not really feel that there will be a little bit more of a bump if this, what you see here, plays out. I think that's all I had to share today. Just my summary on the next slide. Oh no, I have this one here, just to give you an idea where we are sitting at with our patients in the ICU with COVID. So we are pretty much where we've been in December 2020. The last time that we were lower than currently was November 2020. So relatively low in terms of ICU admissions at this point of time. Next slide. So as predicted, Hamilton peak was delayed by about 1 week versus provincial trends. Number of COVID patients in hospitals should start to decline over the next days and weeks. And also a reminder here that the large proportion of those 100 plus patients that we currently have in the system are unfortunately outbreak related. Roughly 1/3 of all those patients, I think today we are sitting at 350 that are considered to be here due to COVID, with all the limitations that we discussed previously of that metric. I think the other good news is that we see as well as stabilizing or even a decline already in terms of outbreaks within the city. So things are moving into the right direction at this point. Back to you, Aaron.
All right, thanks very much, Dr. Mertz, for that update today. Again, just a reminder to everybody, we did have some technical issues today preventing access to everybody that wanted to be here. So we're glad to see that we could have some participants. We were missing some presenters, but we are pleased to have with us Dr. Barry Lum, who's our executive lead for Project Odyssey. As we enter the final 30 days, Barry's going to give us an update on where we're at in that project and what to expect. So Barry, over to you.
Thanks, Aaron, and hi again, everybody. It's always a privilege to be able to speak to you. I'm going to spend a little bit more time today, perhaps on Odyssey than we've spent in some of the more recent town halls, and I guess that's good because we don't have a couple of the other folks on, so I can relax a little bit in terms of time constraints. So phase 4 of the project is really now winding down. And over the months, you've heard us talk about the build, the HHS version of the EPIC Canadian Foundation System. And the HHS version is now, for all intents and purposes, built. And our ability to make changes unless we identify a specific critical item for clinical care is very minimal. And so it's now all about getting you and everybody else ready for the go live, which of course you've heard us talk about is still planned for June the 4th. So lots of activity going on related to training and all of the other things that I'm going to come back to in a minute. And perhaps we can go to the next slide. So we're 29 days from go live on June the 4th. We are not going to back off on this at this point in time. There really is no point thinking about delays. It's now about getting us across the finish line and then moving forward from there. You know, once we get to the 29th, notwithstanding all the incredible pressures on the organization, it is going to be a major change and a significantly improved change for the organization. And so we're just going to keep going at this stage. Next slide, please. And this is really a slide that many of you will also have seen before, but it outlines these items that are really the critical pieces that HHS needs to accomplish to be a modern academic health organization, and we need to get there. At the same time, on behalf of the team, we absolutely understand the incredible, unprecedented pressure that everybody is living under. But to not move into a modern system and to not have a single source of truth for all of our patients as they move across the organization is no longer tenable. And we just need to get this done so that we can move into the modern era as a healthcare organization. So we're going to show you a short video, and then I'll give you some specific items after that.
So, you know, after the initial getting used to EPIC, I think the things that will really change would be that we first of all have better communication between our providers. I think we'll be able to use things a bit more asynchronous. Okay, so how is I going to put this? So being able to being able to access charts on the fly, do some things here and there in the little few minutes of downtime, which other people have told us make a big difference in being able to have free time later.
One of the things that I'm really excited about is how the medication administration system fundamentally changes into a closed loop system. And that ensures that the right medication is administered to the right patient at the right time, and it's the right dose. But it also gets rid of transcription. No more guessing game of what the physician wrote and what the dosing is.
Knowing we're both excited and anxious with the implementation of EPIC, what I would encourage people to do is take a deep breath. Take a deep breath and reflect on all of our accomplishments, all of the work that has been done by so many teams over the last couple of years to prepare for EPIC implementation. Trust the process. Rely on your colleagues and sit tight, because we are going forward. So my other encouragement would be excited. Get involved, continue to learn, continue to participate with your e-learning and your courses so that we're all prepared.
And I keep focusing on the fact that now I have everything in front of me. I can really make use of that to do my work faster and to be able to do better quality work for my patients.
I'm excited because I know that on June 4th, it will just change how we provide care. And now we've been waiting so long for this, and we're almost there. And so I'm so excited. It's
pretty exciting to be able to just bop around quickly in the environment, the EPIC environment, and be able to find anything and do stuff quickly, better than I could before, and doing things I couldn't do before.
Very excited to be here and very excited to know that we are just weeks away from a new system.
Okay. So thanks to Deepak, Carissa, and Karen for those comments. So a few more items we'll cover. I think everybody now has come to learn about this new 4-letter acronym, High Impact Workflows, or HIWFs. And if you haven't taken the chance yet, I would really encourage you to go to the hub, look under the Odyssey tab and under the HIWF tab, because they're all there. They're explained in great detail, and there's endless learning material that is being developed for each one of these high impact workflows that will help you understand what they're all about and how important they are. There's also a new video there that Carissa and I created that kind of tries to bring it together in terms of a clinical scenario of an operative patient and how they all come together in that patient's journey through the system. We are doing high impact workflows of the week. And so if you haven't seen those before, I'd encourage you to look, but this week it's about virtual care, how we're gonna go about continuing to provide virtual care in the organization, and how we will take advantage of this fantastic new patient portal called MyChart, and how patients will be able to get all of the information related to their care directly on their devices when they sign up for MyChart. And so that's a really exciting and a fantastic opportunity for the new world of EPIC starting on June the 4th. Next slide, please. So when we do this, we will be standing up something we're calling the Odyssey Command Center. And some of you may have seen a couple of the videos, one from Vanderbilt and the other from University of North Carolina, showing how incredibly busy, active, and complicated that command center activity will be. But what's it for? It's really for making sure that we provide the organization for all the supports we possibly can, so that when we do this go live event, everybody feels that they're being supported and that they're safe and that their patients are safe. So you're going to hear more and more about this. It is a big, complex organizational activity to get it in place. And the whole purpose of this is to provide supports, because there will be wrinkles. No project of this magnitude can go live without wrinkles, but we will help you every step of the way. So at the center of this wheel, you'll see the Odyssey Command Center. I'm going to say a few words about end user supports in a minute. Every day there will be series of meetings and huddles. We will have continuous communication coordinated through Aaron and Kaylin and the rest of the team to you, and we will have a very well described at the elbow ticketing and phone support. And I'll just mention a little bit about that in the next slide, please. So we have what's called at the elbow support, and it really involves three groups. One are our own internal super users who we have recruited months ago and are well trained in the system and will be moving from being a super user kind of on a part-time basis to full-time when we go live. We also will be bringing in external super users on what we call the non-provider side of the equation, who are also going to be able to provide you with literally at the elbow support on the minutes and hours and days going forward. And then on the provider side, we also will have a very large cadre of individuals who are very experienced in the go live process and in the Epic world to be able to provide that support. So these people will have their little smocks on, as you see here, and they will be distributed across the entire organization. Every unit will have access to go live support, either from a provider or a non-provider point of view. And if you're on the unit and you have a question, all you'll have to do is put up your hand and we'll be able to get you support. If those people can't get you the support you need, we will have access to rapid telephone response, and we will have the opportunity to submit tickets, which will all be correlated and brought together as we all sit in the command center and deal with all of these issues as they come up. So at the end of the day, what I really want to tell you is we are here to support you. If you're feeling nervous, that's normal. And if you get to the unit that morning and you have a question or you're not sure what to do, that's what these people are there for, and that's what the telephone is for and the ticketing system is for. So please have some confidence that we've got your back, and we'll do our very best to make sure that it's as stress-free as we can possibly make it. Next slide, please. What do you need to know? Because of issues related to staffing, we have had a real problem with our colleagues, especially our nursing colleagues, really not being able to leave their units in a safe way to come to training. So we have pivoted to a circumstance where we'll be able to offer a virtual training experience in off hours for those staff who were not able to attend. This is not something that would be our first choice. We really do believe that in-person training is the best way to go, but we absolutely also know that every one of our frontline staff must be trained before they can arrive at the hospital, and Epic is our new electronic health record. So that's in place and is being evolved literally as we speak, and will start to be part of the regular training environment in the non-provider side of the house imminently. I would really encourage you to take an opportunity after your training to jump on the playground and familiarize yourself with what you learned. And I would encourage you to do that more than once, especially in the day or two or three leading up to go live, to just re-familiarize yourself with the system. It's not easy to remember. And so the more you do it and the more you see it, the more comfortable you'll be. If you ever need to ask for help, you of course know that we have our two email addresses. I've already mentioned the importance of the high impact workflows. And if you happen to be an individual that's going to take advantage of the virtual training opportunity, please make sure that you've got appropriate Citrix access, including the need to be able to do what we call MFA or multi-factor authentication. And so at that, I believe that is my last slide. That's a lie. My next slide says, what are we doing in May? Well, obviously we're into May and we're continuing to get ready. The in-class training, of course, will carry on. If you've had a chance or you get a chance to do what's called shadow charting, it's another great opportunity to see how the system will work. We're going to be doing what's called a rodeo events, which are how you'll work with the new rover devices and so on. We're going to be running workflow dress rehearsals at West Lincoln, the JCC, and at the Children's Hospital next week. And if you have the opportunity to take part in those, I think you'll find them also very useful. And then our 30-day GLRA, which is actually going to be less than 30 days, is our last and most important GLRA for next Wednesday, the 11th, for those of you who normally attend that. So once again, last slide, please. Keep reaching out to us and hang in there with us. We know how hard it is, but we think we'll get there. We know we'll get there. And we want to just say thank you as many times as we can to everybody's contribution. So that's me done now, Aaron. Sorry, I went on a bit.
No problem. Thanks very much, Barry. Great update today. And again, just for everybody that's joined us, I know we did have some technical difficulties today. So I know that everybody that wanted to be here or needed to be here couldn't be here. So we did have lose a presenter, and we also know that the participation today might have been lower, but we'll still have a recorded town hall with all this important information, which is great to have. So if you do have any questions about anything that's arisen in our presentations today, if you are viewing live or you are viewing the recorded version, you can of course email those questions to hhsnews@hhsc.ca. That info is available on the hub as well. You can ask questions or maybe make suggestions for content that you think would be important for these town halls. We are on a weekly cadence right now for our town halls as we do continue the march towards go live for Project Odyssey. Okay, so as is our custom, we'll close with celebrations today. This is an opportunity for you to raise a hand and give a shout out live to somebody or something that you want to remark upon. You could also type it in the chat function and I'll read that out for you. So there might be any number of things that are going on that you want to remark upon and celebrate today. Here we have at least some information from Claire O'Connor as virtual care is the high impact workflow of the week. Please consider signing up for virtual care orientation. If you participate in virtual care, a 1-hour Zoom session provided by a virtual care operations team. Find dates and sign up on the hub, and there's some instructions there. So thanks, Claire, for sharing that information. From Steve Jameson, this is North American Occupational Safety and Health Week. For all, please take some time to invest in your health and your well-being. Stay safe. Please see the activities on the HHS dispatch emails that are coming out this week. Yesterday, in fact, was Occupational Safety and Health Professionals Day. So also wishing, Steve's wishing his team, and certainly from all of us to all of you working in that space, best wishes and thanks for your excellent work and support. So that's a great shout out. Bruce Squires, I see you've come on camera. Would you like to celebrate something today?
I have. Thanks very much, Aaron. Today is International Day of the Midwife and of midwifery, and so just wanted to take this opportunity to celebrate all the great midwives who play such a critical role in the women's health program, and specifically the deliveries at Hamilton Health Sciences, and particular celebration and thanks to our new interim Deputy Chief of Midwifery, Lisa Sabatino. Thank you.
Awesome. Thanks for pointing that out, Bruce. Okay, so any other, I'll do a last call here for our panelists or attendees. If you'd like to raise your hand, you can give a shout out live, or if you're typing away in the chat forum and something comes up, I'll give it a read. Carissa Corden has typed something in the chat forum. Nursing Week is next week. Congratulations to all Nursing Excellence Award nominees and to all the nurses who are #answering the call. So thanks for pointing that out, and we'll certainly have celebrations next week as well. Thanks, Carissa. From Nicole Constance, today is National Day of Awareness for Missing and Murdered Indigenous Women, Girls, Two-Spirit, Lesbian, Gay, Bisexual, Transgender, Queer Questioning, Intersex, and Asexual Plus. This day is also known as Red Dress Day. If you can't wear red today in support, consider learning more about this National Day of Awareness The Indian Act calls for actions from the Truth and Reconciliation Commission or Canada's National Action Plan. So thanks very much for pointing that out too. I must say, I'm always amazed this forum has become a great forum for us to share about the different recognition and importance days that occur in our calendar. It's been one of the great values of having this town hall. So thanks to everybody that's brought one to the fore today, including that one about from Nicole. Okay, well, I'm not seeing any other hands up. So thank you again all for participating. Sorry about the technical glitches, but please continue to join us for our town hall again. We'll be joining weekly, so we'll see you again next Thursday. Bye for now.